Hi.
Hi. I'm a student from Blend Nursing Program. I was going to see if I could ask you some questions.
Sure, come on in and sit down. Desk is a little messy.
Oh, that's alright.
Okay.
So, what are the requirements to become a pharmacist?
Well, what somebody would have to do to become a pharmacist is that they would have to attend a college, get a degree in either biology, chemistry, some sort of science. After they graduated that program, they would apply to a pharmacy school. The pharmacy schools in Texas, there's one at Texas A&M Kingsville, there's one in the University of the Incarnate Word, there's one at Texas Southern University, Texas Tech, UT, and then there's one at the University of Houston.
So, do you have a license?
Yes, I do have a license. After you complete the pharmacy program, you go and you take boards of licensure exams. One of them is called the North American Licensure Examination, and the other one is the Multi-State Pharmacy Jurisprudence Exam. And you need to renew these licenses every 2 years.
You dispense medications prescribed by who?
Doctors and physician's assistants.
What made you decide to become a pharmacist?
When I was younger, I worked in a drugstore. I did a lot of errands for them, and I really started to enjoy the medications that were starting to help people. I enjoyed how they were, getting a better quality of life and things like that, so it just really made me want to be a pharmacist.
And how does your practice impact the community?
Well, I'm a certified immunizer, so I can give vaccinations to people, which obviously will help the whole community out. And I also give out medications that help people's quality of life.
What are your duties?
I supervise the technicians, I write labels, I check those labels with the drug names, make sure that they're getting the right drug, the right dose, that everything's right on the prescription. I check it with the computer, I make sure that the client's not on any other drugs that'll interact with the prescription that they are going to take.
Do you do any client teaching?
I do a lot of teaching, actually. I explain to the person why they're taking the medication, how it works, what's wrong with them in order for them to need the medication, about drug interactions, over-the-counter medications that they can take with these drugs, which ones they can't, and which ones are better for them, and which ones they should really avoid.
Do you have any continuing education requirements to maintain your license?
Oh yes, I have to do 15 hours of continued education each year to keep my license. I actually have a list of some of them here. You can just do some of these things to keep up with it. You can do a CPR certification course. You can do a course that's part of a professional degree program of a pharmacy school. You can attend Texas State Board of Pharmacy business meetings, participate in Texas State Board of Pharmacy appointed task forces and things like that.
And how does your job differ from a pharmacology technician?
The pharmacy technicians, they cannot counsel patients, they can't verify prescriptions, they can put information into the computer and they can help me out taking the pills off the shelves, counting them, and then have me kind of verify it before we give it to the client.
Right. Well, I think that's all the questions.
Okay.
For today.
Thank you for coming to visit.
Thank you.